Welcome to another episode of Uninsured by Choice, a podcast where we help you navigate the healthcare system without insurance. I'm your host, Dan, and as always, presented by our sponsor, Zion HealthShare, a nonprofit medical cost sharing community. Today we have Karim Wahib, who has spent over 20 years on the provider side as a physician assistant practicing mostly independently on the Upper East Side of Manhattan, where he witnessed firsthand how the value proposition of health insurance has shifted for patients and providers alike. That experience led him to confront a persistent reality in his practice, navigating the uninsured and underinsured through the healthcare system without good options. He is the founder of FixCare, a direct healthcare savings program that gives anyone access to high quality care in New York City and Austin, Texas for less than $1 a day. So Kareem, welcome to the show.
Thanks, Dan, for having me.
Yeah, of course. Would love to hear a little bit about your origin story. Over 20 years practicing on the provider side. Why don't you tell us a little about your experience and background out there in New York?
I was an athletic trainer, so I did sports medicine at the college level and at the high school level before I went to PA school. And then went to PA school in like 2001, graduated 2001. So it'll give you a sense of how many years I've been at it. And been practicing orthopedics, primary care, sports medicine, as well as, in the OR. We would work in the city where I got to a point where we would rent space from primary care offices and put in little orthopedic clinics and then manage 85% of those patients medically, right? They didn't need surgery. That you could take care of a lot of orthopedic issues, just basically office-based orthopedics. And then like that 15% that needed surgery, we had a cadre of different specialists through our network that we would refer those patients to. So we saw, back then, this is like pre-ACA. So we had a little bit of like HMO managed care, which was like the first kind of consolidation of insurance where we'd say, hey, we're in this HMO plan, but the practice is relatively getting capitated money, meaning they get monthly payments from the insurance company. But if any of those patients went out of the network, then they would just penalize you, right? So you wouldn't get that monthly kind of contribution. So that was like the HMO world, the health maintenance organizations. And then 2010, the ACA kind of solidified. And that affordable care kind of component, really what it did was start to centralize practices. We saw the change in the landscape. We're like, all right, a lot of providers aren't able to keep their doors open because the money that they're getting from the insurance companies kept decreasing. The cost to keep the doors open kept increasing, right? So you have this decrease in paying providers, then you have the increase in rent and insurance and the such. And then we started seeing patients with less and less insurance options. They had high deductible plans. They came in uninsured, but they were working. They had a small business or they, just elected to go uninsured. And they just would ask like, I don't have insurance. How much is it? And we had a fee schedule for patients like that. But then trying to get specialty care for them was like, how do you get an MRI? How do you negotiate with the labs for blood work? How do you get someone a surgery, right? So we started recording all the people we would refer to and kind of figure out like what these numbers roughly would be. And we were on that precipice of really taking care of patients that were uninsured, but were able to kind of self-insure themselves, right? And this was back, 2015, 16, 17. It was informal. We just would make phone calls, but now up till now, 2026, like we have this whole platform that was built out where we have a network of providers who give us either a generous discount or something that they can give because everybody's overhead's different. We don't really beat people up of what they could afford to give as a cash price to the members. But we took away the pain point of what insurance is. Like insurance pain points are, it's expensive. The premiums are expensive. The deductible's high. So you're essentially walking around with uninsured until you hit your deductible. And it's difficult to use. And there's barriers to use it. So all these four major points, with FixCare, we display the rate that with membership and without membership, you could see the doctor, and this basically you have a transaction directly with that doctor, and just using us as a platform. We're not even a fiduciary in between that. We just have the members pay the doctors directly. So this is the A to Z so far for this. And what we do with FixCare is we market it to small businesses, individuals. In New York City, the 5 boroughs, there's 183,000 registered small businesses. We're going after that demographic of the small business that that middle of the bell curve, so to say, because the ends are taken care of, right? The lower end is paying, we pay our taxes for that and they're subsidized. The other end, well, they're wealthy, right? So they're basically legacy wealth and they're able to pay for those things. We're talking about the working middle class that keeps getting, beat up because they don't make enough money to qualify for state or federal subsidies, but not enough to cover the burden of a heavy premium, even if it's partially tax deductible. There's a huge swath of that to great complement our discount medical network for cost sharing because we already pre-negotiated the rates and you're getting the better deal at the point of service opposed to going back and forth and trying to negotiate after the fact.
Yeah, that's such a cool story to be able to look at this insurance landscape and how much it has changed because you were there pre-ACA. You were there in the immediate aftermath of the ACA. We've had several guests affectionately refer to it as the Unaffordable Care Act. What it really did was drive up the costs in a number of ways. So what was that breaking point for you to say, I'm going to start this FixCare network for direct pay to do something about this? What kind of led up to that, to where you just said, this is the breaking point. This just doesn't work anymore. The insurance, like you mentioned those points, this insurance industry is just broken. We've got to do something.
It was COVID. So the ACA happened. It led up to this, ascending to the pinnacle of a cliff. And then COVID happened. They basically shut down all the private practices, right? So if you worked for a hospital system, you're still getting paid. But if everybody was staying home and you were a private practice, guess what? You basically shut your doors. We weren't seeing any patients. And if you're a fee-for-service kind of practice, well, you're not seeing patients, so you're not getting paid. And then the internal medicine practices who we partnered with all consolidated. They either, sold to bigger entities or sold to the hospital system, got absorbed by, other insurance companies who have these branches of medical services that are siloed, integrated into their platform. So COVID actually was the eye opener. We all saw it, basically the stock price of the top 4 insurance companies kept going up and up because they were getting premiums, but they weren't giving care, especially elective care, because no one was seeking elective care for almost 2 years. The way we practice now, that we practice was with our partnerships, was getting evaporated because we were losing our private practice partners. Took a break, did some other work on the occupational health side, and back in business school now. But really, the precedence was when was the actual public outcry. So the healthcare executive was assassinated in broad daylight in Manhattan, probably about 20 blocks from my office. The response was not a lot of empathy. If you go through the social media, there wasn't empathy. The guy could have been a great guy, I didn't know, but because of his involvement with the insurance company that would deny care to the average American who paid their premiums in order to profit from that, I'm like, okay, well, because of the sentiment, we need to build new rails, right? Because the rails currently that are involved only profit stockholders. It's a wealth extractor. We had the chance, when they were drafting the Affordable Care Act, we already had existing rails, right? On the federal side, we had Medicare. On the state side, you had Medicaid. You could have just expanded that and let you and I buy that. If we could buy Medicare, it would cover 80% of things, and the insurance companies would still make money on the 20%, that wasn't covered, the supplemental insurances. They could sell supplemental insurances all day, but the bulk of it we could have paid into and utilized it. What would that have done? That would have increased the dollars into the Medicare system and eliminated the Medicare tax. And the rails were already built. People could get on and register for it. But no, the insurance lobbies got in, entrenched themselves, and they built new rails to accommodate and give this kind of project to private sector for them to manage.
Yeah, and I still remember the Speaker of the House, Nancy Pelosi at the time, getting up and saying, we must pass this bill to find out what's in it. And I thought, what more straightforward way of saying we had nothing to do with the creation of this legislation. It was authored entirely by health insurance lobbyists, than to say, we have no idea what's in it, but let's pass it and then see how it goes. There was an opportunity to really do something like you said. And unfortunately, that's not what happened. And we've been dealing with the aftermath for, coming up on 2 decades at this point. What's FixCare? How does it work for someone who'd be interested in learning about what this model kind of is? Because it's not nationwide, it is in specific areas, but others could create something similar if you kind of outline just generally how this works.
Yeah, so it's a dual-sided marketplace where we negotiate cash rates with private practice providers in an area. We build small medical communities. And these are for the uninsured or underinsured, right? So say, people equate access to healthcare with insurance. So we built access at a really, really low entry point where everything's transparent. People can use to see it. So people could, depending on where your risk tolerance is going to determine what you get, right? So if you want a $15,000 bronze plan, you'll buy that, right? Or if you want a gold plan because your risk tolerance is low, you'll pay for that, but you're paying for it. With FixCare, you can just say, all right, I just want access to doctors at a transparent rate that's best in class, and I can get in. And they worry about the other stuff. So to kind of dismantle that, like, yeah, and anybody that's an operator or has like a good referral network or primary care doctors, old drug reps that had territories, like anybody can build this. The issue is that we lost 80% of private practices since the ACA. Like 20% still practice independently. They're hard to find. Building FixCare, now what we did was we built a network of independent providers that are like-minded that now could refer to each other. Because what happens inherently, if you're a primary care doc, you can't find an endocrinologist, you send that to the hospital. Guess what? Like the hospital retains that patient and silos them within their primary care. Very rarely do independent providers in the community will get referrals from the hospital. Never happens. They silo that in, it's all built in, so they extract it. So with FixCare, now you have a network of independent doctors that can all refer to each other. So we keep that kind of like independent, patient-centric, keep costs down. We let the patients know what things cost before they utilize them. Feedback is really great. We've got a few dozen now on here. We just went live probably about like nine weeks ago, and getting good adoption. And people like, the feedback. Like right now, like I'm the patient concierge trying, if they have questions, like it's me now, but it's pretty self-explanatory on the site and people are able to get in. We've got our providers able to verify the members if they're active or inactive when they come in, because we show the prices. If you want to go on the website, you can say, all right, I need to see a primary care doc. 5 of them will pop up and all of them have different prices. You go down the road and see which one sees you first, and the prices are reasonable. And they're low volume, independent docs. So it's a great experience for the vast majority of people that use it.
Yeah, I like that. It works on both ends. So for patients looking for care, you get this membership to FixCare, and now you are sort of in this network style group of doctors who all have cash pay rates, or even discounted beyond the regular cash pay rates in some cases, it sounds like. But then if you're a provider, you now have a confident referral network of sorts, because you don't want to refer to these big, huge integrated verticals, hospital systems where they've got everything in there. You send a patient to, like you said, an endocrinologist, a urologist, any specialist, and now they're in that network. They will never come back to you, and you've solved for that as well. So it really works in both sides. And the beauty of it is there's no insurance involved. It just says, this is what things cost. That's getting back to that true sort of free market principle that America is really founded on, which is that competition's a good thing in the marketplace. And that's what healthcare really lacks, is that the insurers hardly compete with each other. The providers are hardly competing with each other. They're just trying to own as much of it as they can so they don't have to compete with each other. By creating this solution, I think you've made a really clever way for people to navigate their healthcare without insurance in a way that works for both patients and providers.
Yeah, I mean, it's provider centric. Like, how do you build a healthcare product or a network or philosophy that benefits patients and providers? Like, you're either a patient or you're a provider, right? Like, building a third entity in there just value extracts. So yeah, thank you. Yeah, that's basically in a nutshell. On the back end, we partner with health shares and medical cost shares. So we partnered with two. At one of them are Zion. We give people that option where it's like, explain to them FixCare is great for about 85% of the things that are, outpatient. But if there's an unexpected hospital event or an unexpected surgery, you want someone in your corner with some kind of like, well of money to help. And so I always like the philosophy of cost shares in that manner because it's more community driven and it's not insurance. It's a misnomer that we think insurance is always going to cover us because in practice, and we've heard all the stories, physicians that order treatments or tests that are either life saving or needed for electively are constantly denied. And when your business model is taking premiums, manage those premiums, and pay less than you take in order to increase your stock price, that's a problem. So you have there's a disjointed incentive process that has nothing to do with the provider or the patient. It has everything to do with profits. Cost sharing basically puts that member at the forefront of that because even though they're not regulated by insurance regulators, they are highly sensitive to the Better Business Bureau. They are highly sensitive to any kind of negative connotation towards those specific entities. And they do, in my experience, everything that they can do to make that patient whole, that member whole, so everybody's happy, so they keep, contributing to the program. If you're a disgruntled insurance, member, they could care less. Like, try to sue them. They have 20 attorneys sending cease and desist letters all the time. Try to complain about them. They don't care if you complain about it because their stock price are doing gangbusters. I mean, there's a lot of bad press for a couple of the insurance markets now, but because with Medicare Advantage, increasing their rates, all the stock insurance, stock prices went up, about 13% over the past few days. Those are taxpayer dollars being given directly to private entities. Our tax dollars go right into it, even though we don't use it. So we're in a mechanism where the middle class pays the most in taxes to subsidize these health products, but they use it the least because they don't qualify for state or federal subsidies. It's an interesting kind of construct that as far as like a wealth extractor that's going on right now, the American populace, especially the tax paying populace.
You could sort of view any industry or company as a wealth extractor or wealth generator or anything like that. But when it's based on life and death, that just doesn't seem like the kind of thing that should be driving anyone's wealth. And you look around the world, other developed nations don't all treat it that way like we do. They do treat it like a life and death situation. Say, you know what? We really shouldn't hold people's feet to the fire here because what choice do you have? I want to live, not die. So I'm going to do whatever it takes. And when you feel pigeonholed into this, everyone has to get insured, which, like you said, doesn't even amount to much, anyways, with all the denials that are out there. But I like how you talk about pairing something like a FixCare with a health share or something else like that. It really is all about less about being a passive spectator when it comes to your healthcare and more about being an active participant and saying, I'm actually going to vet out the people these potential providers. When I move to a new place, I'm not just going to go say, who's the nearest doctor? And there I go, or call my insurance. Who's in network? They are. Great. I'm going to go there. No, you'll actually see what the reviews might be, what the prices might be, what the options are, and then say, no, actually for me and my care and what I need, this doctor is going to work a lot better than that doctor. And I shouldn't be told by my employer, by my insurer, or anyone else that I have to go see the doctor that I don't want to see. I should be able to choose that. And that's what we're doing with health sharing, with fixed care, with direct care and direct pay, that whole ecosystem. So how do you see this, evolving? You're new, you're small so far, but how do you see it evolving and expanding this whole direct care and direct pay ecosystem across the country?
The issue is that like there's no change in the horizon. All of this, noise we got out there, there's no real change unless you have lobby reform. As long as there's health insurance lobbyists and they're able to basically contribute to politicians who are the decision makers to policy, like nobody's lobbying for the American people, right? So even if you say, "Oh, I'm going to lobby with my vote," you you're getting the choice of two people in most parts of the region that are definitely both getting contributions from the lobby, the same lobby. So you have to make new rails. This past year was the turning point where my conversations with people that run these cost shares or on the sales side, they've had banner years this year because of the messaging and the loss of the tax credits and the changes in healthcare. Health shares have been more popular. With health shares, you can go and say, yeah, there's no network, great. But you still have to go and negotiate those rates or ask what the cash price is and make sure it makes sense. We already did that.
Yeah, the whole direct ecosystem isn't just directly paying for direct care, but direct everything. Just knowing the sources of food, your information. There's so much misinformation online too. People will say, "Well, this is healthy." No, that's not healthy. This is, and well, which is it? The complexity of it all, that layer that insurance adds, just makes it so that I think people throw up their hands and just say, "I don't know. I don't know." We're all going to die. We're all going to get cancer. We're all going to die at some point. So I'm just going to enjoy it while I can. And this defeatist attitude that is so prevalent online these days. Everything about healthcare, medical, just health in general. It's tough to navigate, but it's always nice to see people who are doing something about it. That's what we're trying to do on the podcast in our own way. Thanks again for being on the show today. Remember, you can subscribe on YouTube, Apple, and Spotify, and we'll catch you all next time.